Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communication specialist with Quality Insights, and today we'll be discussing immunization updates for long-term care. Today's discussion will be a rebroadcast of our November 8th presentation by Quality Insights infection preventionist Jennifer Brown. Jennifer is here today to take questions at the end of the presentation. So if you have questions or comments, you can please submit them to us using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is taking another look at antipsychotics. That webinar will be the same time and place next Wednesday at 2 p.m. And now I'm going to share my screen and start playing the recording from our presentation. And when I'm done, and I will stop the recording and we will have our Q&A. So this will take just a moment to set up. And when I hit play, please let me know if the audio either sounds too loud or too soft, and I might be able to make some adjustments. And now I'd like to introduce our guest today, Jennifer Brown. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has led several quality improvement and infection control initiatives in acute and ambulatory settings. Jennifer, thank you for joining us again today.
Thank you for having me. Thank you. Today, we're going to talk about immunization updates for long-term care. In the face of the ongoing challenges posed by infectious diseases, the importance of vaccination in nursing homes is extremely important. Nursing homes provide care for some of our most valuable individuals, including elderly residents and staff members who provide their care. So ensuring the health and safety of this community is a shared responsibility, and vaccination is a powerful tool to achieve that goal. So today we will discuss some of the critical aspects of vaccination within nursing home settings, such as information about the influenza, pneumococcal, COVID-19, and RSV vaccines, strategies for addressing common concerns and myths surrounding vaccination, strategies to increase vaccine acceptance among both residents and staff, and principles of vaccine administration and safety. We'll also discuss the importance of collaboration with local health departments, access to valuable resources, and support of national and local initiatives. Vaccine in nursing homes are vital due to the number of elderly residents who live in nursing homes. Some residents also have weakened immune systems and underlying health conditions, which lead to reduced ability to fight off infectious diseases. Equally important are the staff members who provide care and support to residents. Vaccination plays a pivotal role in creating a shield around those who are in this close-knit community. By ensuring that both residents and staff are adequately vaccinated, we reduce the risk of severe illness and complications and prevent outbreaks. The benefits of vaccination for both nursing home residents and staff are many. For residents, vaccines offer a shield of protection against potentially life-threatening diseases. According to the CDC, staying up to date with flu and pneumococcal vaccinations have been shown to significantly reduce the risk of severe illness, hospitalization, and complications, thus contributing to a higher quality of life. Vaccines impact staff as well. By getting vaccinated, staff members become less susceptible to infectious diseases, reducing the risk of transmission within the facility. This not only protects the residents, but the workforce, ensuring the continued provision of essential care. Today, we'll discuss some of the recommended vaccinations, including influenza, pneumococcal, COVID-19, and RSV. First, we'll discuss influenza vaccines, commonly known as flu shots. These vaccines protect against the 4 strains of influenza virus that are expected to be most prevalent in the upcoming season. For people 65 years and older, the CDC and ACIP, the Advisory Committee on Immunization Practices, has recommended the use of 3 flu vaccines for that age group. The recommended vaccines are the Fluzone, high-dose quadrivalent, Flu Block quadrivalent, and Fluad quadrivalent. According to studies, these vaccines are potentially more effective than the standard dose for this age group, but there are no preferential recommendations for people younger than 65. Pneumococcal vaccination is available for those 65 years and older. For individuals that have not been vaccinated against pneumococcal, the recommendation is for a dose of the PCV20, or they can get a PCV15 and a follow-up dose of the PPSV23 a year later. The individuals who have had previous doses of prior pneumococcal vaccine, they are able to get an updated PCV20, or there is a vaccine schedule for other combinations of the vaccine depending on which dose they've already received. COVID-19 vaccinations, we do have the updated 2023-2024 COVID-19 vaccine. The COVID-19 vaccines are safe and meet the FDA's scientific standards for safety, effectiveness, and quality. And these vaccines have been approved for the new season as of September 12th. They are currently working well against the current variants, the BA2.86, and continue to be the best way to protect yourself against severe disease. The benefits of the COVID-19 vaccine continue to outweigh any potential risks, and serious reactions after COVID-19 vaccinations are rare. The recommendation for the COVID-19, you're up to date when you get one updated Pfizer or Moderna updated 2023-2024 vaccine. The RSV vaccine is also approved for elderly individuals. It protects against a common respiratory virus that usually causes mild cold-like symptoms, and most people can recover, but in older populations, they are more likely to develop severe infections with RSV that can cause shortness of breath, low oxygen levels, and even hospitalization. So CDC recommends a single dose of the RSV vaccine for adults age 60 and older. This is a shared decision-making with their healthcare provider. They should consult with their healthcare provider to decide whether or not that vaccine is best for them. So one of the major things that we have at this time of the season, we're starting our vaccine clinics, and we get a lot of common concerns and myths surrounding vaccines, including COVID, but also flu and pneumococcal. So some of the things that we see is safety concerns. Some individuals might worry about the safety of the vaccines, fearing that They can cause severe side effects or long-term health problems. And we also see misperceptions about vaccine ingredients, myths about them being harmful, such as mercury, aluminum, preservatives. There's some concern about the mRNA component of the COVID vaccines. We also see the discussion about natural immunity versus vaccination. Some individuals might believe that natural infection is better, underestimating some of the risks from the complications associated with contracting the actual disease. And there's also concern about effectiveness, their perceived lack of risk, some religious or philosophical beliefs, and concerns about over-vaccination, overloading their immune system with multiple vaccines, even though the recommended schedule is carefully designed to ensure safety and effectiveness. So some things that we as healthcare providers can do to help build vaccine confidence is the use of active listening, the having empathy and respect, approaching the conversation in a respectful way, using visual aids, providing accurate information from reputable sources, and sharing personal experiences from people who have real life experience. Can be very powerful in countering some of the myths that we encounter. Some things we can also do is assess the residents' unique concerns. If they have something that's very specific, listen to them and provide updated and reputable information about their concerns and fears. This is very important to establish trust between healthcare providers and residents, because that can really positively impact vaccine acceptance. Engaging their families and other caregivers, having conversations with their families and other loved ones to talk about their concerns of getting the resident vaccinated, and that can really influence not only the family but also the resident's decision to be vaccinated or not. And encouraging the residents' participation, letting them have an active role in the decision-making process, so they can feel like they have the information they need to make an informed decision. For staff, it can also be a challenge to address some of these concerns. When addressing staff about the recommendations for vaccines, for flu and COVID vaccinations in the facility, make sure that you're giving tailored communication. Talk to them at the level that they can receive the information. Sometimes having peer influence is helpful. People who are respected in your community, giving their recommendations, that could be really helpful in increasing acceptance. And also continuing education, using training and information from some of the state partners that can really help provide information from a different source, and it may help hearing it from someone else. Identifying and addressing staff concerns, implement strategies to identify and address their concerns who might be hesitant, engaging staff in, having effective communication when regarding the vaccination. Make sure that, there are things that, maybe fun activities that are a little bit different approach that could be helpful, and, making it less, this, you have to do this is what we need to do, make it something that's, fun and engaging for them. Ensuring ease of access for vaccination. And we'll talk a little bit more about this when we talk about our vaccination clinics, having vaccines easy to access, having on-site vaccination clinics, and timing that is convenient for their shift, or something after work, before work, where they can get it and it's convenient for them to do. And also encouraging vaccination as a team, normalizing annual vaccinations, sometimes approaching it as, this is something we all do. Let's just, we're going to get our vaccines today. That could be a good way to encourage staff to get their vaccines up to date. As I mentioned, we're going to talk a little bit about vaccine clinics. I know that there has been, some hiccups with getting the updated COVID-19 vaccines, but, I know that some facilities are getting them scheduled, so they're on their way. I want to talk about, getting ready for it, because there are some things you can do to prepare. That way, when the vaccine is available to you, it'll be ready to go. We want to implement on-site vaccines clinics, if possible. Some of the benefits of on-site vaccination clinics include convenience, increased vaccine coverage, timely vaccinations, minimize barriers, increase trust. Sometimes getting it from someone that can reduce anxiety, and then also an ease of data collection, and also resident and staff wellness. Some other things you can do to prepare for your vaccine clinic is ensure that your staff is trained and up to date with competencies, especially around intramuscular injection competencies, vaccine storage and handling, and sharps disposal, and have those competencies up to date. And that way, when your clinic is ready to go, everybody is ready to start right away. Implementing strategies for ensuring the safety of vaccine administration and minimizing the risk of adverse events. So some things you can do is to review the residents' allergies ahead of time, reviewing the medical and vaccine history, emphasizing the use of proper injection technique for those who will be administering the vaccine, and a review of aseptic technique for those individuals as well. And also vaccine documentation is important in your clinics, making sure that you're properly tracking who is eligible for the vaccine, and also, after the vaccine, monitoring for safety and documenting anything that comes up. And that way, for future vaccinations, you'll have that information readily available. I also wanted to discuss the regulatory and compliance component, having consents available. Those are some things you can get ready ahead of the clinic. The vaccine information sheet that is required by law to be given, make sure those are available and the most up-to-date VIS is available. And for vaccine documentation, there are different requirements for each individual vaccine. So make sure you're up to date to know what you need to document. And also for the electronic health record for the resident, making sure that the vaccine is recorded there and tracked within the facility. Vaccine reporting can vary from state to state, and also based on who is providing the vaccines. So I have a section here with some state and local resources. This is the Pennsylvania Department of Health Adult Immunization page, which has information about immunizations, and also a link to the Pennsylvania statewide immunization information system for reporting vaccine clinics. I also have for West Virginia the link to the West Virginia Division of Immunization Services and the West Virginia statewide immunization information system. Some other resources that might be helpful as you approach vaccination at your facility: Quality Insights. We do offer on-site assistance with vaccine clinics, or if you have any questions about vaccines or reporting, we can do one-on-one consultations surrounding vaccines. And also immunize.org. You can get their updated information about vaccines. They also have the VIS statements on that site. CDC also has a lot of information about vaccines, and the Agency for Healthcare Research and Quality has some information for building trust amongst vaccine recipients. Does anyone have any questions?
Okay, let me stop sharing my screen and turn my video back on. Here we go. Welcome back. And yes, at this time, we're ready for our Q&A for today. As I said, Jennifer Brown is here to take questions. So if you have a question, please submit them using either the chat or the Q&A tool in your Zoom menu. You can also raise your hand to request to be unmuted to ask your question out loud. And while we wait, I'd like to again run over a couple quick items. Next week's webinar will be about antipsychotics in long-term care, and that will be next Wednesday at 2 p.m. So if that is of interest to you, we hope you can join us. And we also invite you to bring your questions to our virtual live chats every Tuesday and Thursday at noon. Deborah Wright or one of our quality improvement specialists will be there to answer your questions on topics such as quality improvement initiatives, infection control, or MDS coding. And you can find the links to our live chats and the webinars in our newsletter that we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list, you can email me at ccaudell@qualityinsights.org and I will get you on that list. And now I will put my information and Jennifer's and look to see if we have any questions yet. It does not appear that we do. While we're here, I'm going to also share the link to the slides from today's presentation in case anyone needs those as well. So that is all in the chat now. And we'll wait just a minute before we close out today. I don't see anything in the Q&A either. Now, Jennifer or any of our other quality improvement specialists here today, do you have anything you'd like to say before we wrap up?
No, I don't think I have anything to add at this time. Hope everybody has a wonderful Thanksgiving.
Thank you, Jennifer. And yes, we definitely hope you have a wonderful Thanksgiving. I'm going to go ahead and close this out then. If I can get my script back up. Okay. So before we sign off, we'd like to ask everyone here today to please answer a short evaluation of today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we'd appreciate it. I'd like to thank you all for joining us here today, the day before Thanksgiving. And Jennifer, thank you for joining us again. Hope to see you all back here again next week.